Hello, everybody. So this is a continuation of our series of medical terminology, and this is number 3. So what we have today, hemolytic uremic syndrome, Shiga type of bacteria, Shiga-like toxins inactivates 6Ts ribosome, which will increase cytokine release. Tetanus will cause tetanospasmin, cleaves snare proteins, and this will lead inhibition of release of inhibitory neurotransmitter, which is GABA and glycine, from Renshaw cells, which will cause this spasm, which we know. Botulism is a toxin. It is a protease, cleaves snare, reduce neurotransmitter acetylcholine release at neuromuscular junction. Gas gangrene, alpha toxin degrades phospholipids, lead to myonecrosis and pruritus. Toxic shock syndrome, scarlet fever. What is that? TSS, which is abbreviation, 1, and erythrogenic exotoxin A cross link B beta region of TCR to MHS class 2 on antigen presenting cells outside the antigen binding site, which will massively increase interleukin 1, interleukin 2, interferon gamma, and TNF alpha. Okay, tumor necrosis factor alpha. Shock and DIC caused by gram-negative bacteria, lipid A of liposaccharide macrophage activation, TLR4 and CD14 complement activation, tissue factor activation. Prosthetic device infection. Some people they have a prosthetic device, like urinary castor or whatever, infection by Staphylococcus epidermis, biofilm production, or inserted prosthetic device into the body. Endocarditis secondary to strep or Staphylococcus sanguineus, dextrans form biofilm production, fibrin platelet aggregates bind to damaged heart valves. Pseudomembrane colitis secondary to Clostridium difficile, toxin A and B damage enterocytes, lead to watery diarrhea. Diphtheria, exotoxin inhibits protein synthesis via ADP ribosylation of elongation factor 2, lead to possible necrosis. Virulence of M. tuberculosis, Mycobacterium tuberculosis, cord factor activates macrophages, promoting granuloma formation, induces release of tumor necrosis factor alpha, sulfatides, surface glycolipids, inhibit phagolysosomal fusion. Tuberculoid leprosy, T helper 1 immune response, lead to mild symptom. Libromatous leprosy, predominantly T helper 2 response, can be lethal. Lack of effective vaccine for Neisseria gonorrhea. Why? Because there is antigenic variation of pilus proteins. Cystitis and pilocystitis is UTI affecting the bladder. Pyelonephritis affecting the kidney, UTI. Secondary to E. coli type of bacteria. Mechanism Fimbriae or B. villi. Pneumonia, neonatal meningitis secondary to E. coli, K. capsule. Chlamydia, resistance to beta-lactam antibiotics, lack of classic peptidoglycan due to reduced muramic acid. Influenza pandemics, RNA segment reassortment, lead to antigenic shift. Influenza epidemics, mutations in hemagglutinin, neuraminidase, lead to antigenic drift. Okay. Central nervous system invasion by rabies, binds to acetylcholine receptors, retrograde transport dynein R. HIV infection binds CD4 along with CCR5 on macrophages early, or CXCR4 on T cells late. Granuloma, macrophage present antigen to CD4 positive and secrete interleukin 12, lead to CD4 positive differentiation into T helper 1 cell, lead to interferon gamma secretions, lead to macrophage activation. Limitless replicative potential of cancer cells, reactivation of telomerase, maintaining and lengthening telomerase, prevention of chromosome shortening and aging, tissue invasion by cancer lead to reduced cadherin function, reduce intercellular junctions, basement membrane and extracellular matrix degradation by metalloproteinase, cell attachment to extracellular matrix, proteins, laminin, fibronectin, locomotion, vascular dissemination of cancer cells.